welcome people to that. Vascular uh, emergencies, cardiovascular emergencies, whether at vacation, at work, or so any place. People are in vacation right now. Easter holiday is like a very long weekend from Friday to Monday. So things are when you try and find time so that you come and you continue a medical talk that you usually talk, and you check it that you realize that I'm not continuing with the normal topics. I'm doing random topics because from Tuesday that's when we start. Right now, so many things are happening. The getting up and coming with the topic takes a long time. So let's see what we can do today. Today we are doing emergencies really, how you can take care of emergencies when you are in vacations or when you are in yeah, morning. Here it will be 5 evening. Yes, I'm the morning. Yes. Now, there are some things we need to know when someone is you can have an emergency when you are on vacation. You can have an emergency when you are at home. But today, because it's a series of vacations right now, we want to look at how you can handle. And if you are watching, don't just keep it at like share travels here, just share travels in the house. Thanks for tuning in on this talk. The talks will continue on Tuesday, but right now we are doing random talks. Right now we are doing random talks, and we just here to see things how we can manage some things when we are at home or when we are doing some things. Let's get to see some emergencies that we get into when you are in a vacation or traveling or doing something and you get into an emergency. Now, uh, you can go in a vacation and excite yourself to get myocardial infarction. You can go in a vacation and you excite yourself to get myocardial infarction because myocardial infarction is the blockage of coronary artery, as we see. But it takes a short time when your heart muscles lack oxygen, and then you start getting problems. You start getting the problems of chest pains because within 2 3 hours, when your part of your heart muscle has no oxygen, part of it can die. You get it? So myocardial infarction when you're at a vacation, yeah, the Jamaican uncle has arrived. Thank you so much for being here, uncle. So we say that myocardial infarction is one of it. Cardiac arrest, heart stops pumping effectively with no pulse and you get to unconscious. Yeah? Sometimes even you require CPR. This is something else. When you are traveling and you are at home, you are in vacation, this is something that can be of interest. Ventricular tachycardia. We have talked about arrhythmias, and tachycardia was a topic of interest. You are traveling, you are having a vacation, and all of a sudden you start having tachycardia, abdominal breathing from the ventricles. You get it? This one excites palpitations, and then you collapse. Those people that always get palpitations, be sure at a point you are getting this tachycardia, tachyarrhythmia, ventricular fibrillations, irregular pulses. This one can be risk of stroke. I'm going through them so that we can go one by one. These are things that you can get when you are at a vacation. You are really enjoying yourself. You are at home or in church, and then you just get an emergency. And we want to know how to handle this when you are at the scene. When you are at the scene, it is important we learn how to handle these things when we are at the scene. Acute heart failure, fluid accumulations in the lungs because of the pulmonary flow from the right ventricle to them, from the right ventricle to the lungs. Get it? Hmm? This one is a big thing that Maje is here. Maje, welcome. Welcome, Shah Travels. Welcome, Jamaican Uncle. I'm talking of accidents that happen when you are at, you get it, humble mercy, greetings and blessing everyone. Welcome. So, acute heart failure, fluid accumulation in the lungs. You get it? Fluid accumulation in the lungs. Sometimes people collapse and then you go to a hospital and then you find that you have fluid accumulation in the lungs. Here, you get severe breathlessness when you are just in there because of what? Coronary occlusion, coronary blockages. You see, and many things come out and come up of coronary occlusions, things that may excite. Yeah? Now, pulmonary embolism, common after long travels. You travel, you are in vacation, you want to go road trip here and there and everywhere, then suddenly you feel your chest is having severe pain. Can be fatal if untreated. Can be fatal if untreated. You get it? It can be so fatal if untreated. Unstable angina, chest pain at rest, but when you are working, you are okay. This one is a warning sign. When you are at rest, you feel chest pain, but when you are working, you feel that it is relief. This one is a sign of impending mitral myocardial infarction. One of the muscles of a particular place uh, of your heart can die anytime. Pericardial tamponade, reduced cardiac output, hypotension, distended veins, and urgent drainage. Hmm? Let's see. Let's kind and see what excites. Hmm? Mercy, welcome to the classroom. We are talking about when things that can happen accidentally and how you can help them. Hmm? Just a minute, my friends. Just a minute. I'm setting something. Yes, there's something that can make these things that I'm going through to occur. I've gone through so fast with them. There are like 10 points: myocardial infarction, cardiac arrest, ventricular tachycardia, atrial fibrillations, acute heart failure, hypertensive emergencies, hypertension above 180 of 120. Imagine you are in vacation and then you just get hypertension of more than 180 of 120 with organ damage, headache, chest pains, and you see, eh, pulmonary embolism. Embolism or common when you're traveling. These are things that occur when people are in holiday. Greetings, Judy. Judy, welcome. Welcome, Marcia. Massive Grace, welcome to the platform. Aortic distension. And as I talk, uh, let's 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 talk about what you saw one day in life, your experience of cardiac issues. If you are just traveling and you saw someone has high BP all of a sudden, or if you are just in a vacation and then someone was rushed to hospital because of heart attack, let's exchange. Let's see if you have ever met. How did was the experience? How did the doctors help? There is a condition called pericardial tamponade. It gives reduced cardiac output. So you get a potential, and then if you look at the neck veins of that person, you will see that they are distended. It needs urgent, urgent drainage. Pericardial tamponade is water in the pericardium layers of the heart. Pericardium tamponade means the layers of the heart, the layers of the heart. This layer, this one. It means these layers of the heart, they are filled with fluid. Get it? They are filled with fluid. So let's continue in this sense and say why cardiac issues occur escalate during a vacation, because it's vacation time. Right now, it's vacation time. So many people are not even going to work. In Kenya right now, so many businesses are closed because people have traveled to see family at home. And people, Kenya is a Christian. 3 quarters of people in Kenya are Christian. So when it is Easter, it's like a Christmas holiday. People have gone home. People have gone to do their work. Yeah, yeah, yeah. And you see, people have gone to do ABCD. So we want to see what escalates these things, what makes people to do what makes the people to undergo these issues. You see, now when you are in vacation and traveling, people overeating. This one triggers in cholesterol and triggers myocardial infarction in parties. Vacations is time to eat, time to test whatever you've never tested. And those foods that you are testing, most of them have high sugar levels. And high sugar levels, you remember what does it do? It increases water retention, worsening heart failure. Maybe you are having impending heart failure. Maybe you are having impending heart failure, and you are now in vacation. You are very happy. You have forgot that you are having an impending thing, so you are eating. Eh? Heavy meals increase cardiac workload. Heavy meals, when you eat a lot, it means that you are having metabolism rate will go up. Metabolism rate will go up. And that one means your heart should pump blood faster and faster. Heavy meals. You see, we are going to party as Ben. It is a vacation. I've met my uncles, my friends, my long gone friends. What do? We take alcohol. Alcohol. Alcohol increases atrial fibrillations. Very fast heartbeats that are not even normal. They are called fibrillation. And then you've taken a lot of alcohol. It leads to electrolyte imbalance. Your kidney starts to suffer because it cannot filter well. You have given a lot of drugs. You have given a lot of things that you are. Now we are talking about vacation. We are in vacation. Hmm? And alcohol can precipitate dangerous arrhythmias. It can make even your heart to stop. Yes, Miriam Mumbua, welcome, welcome, welcome to the platform. As normal, this is we talk about things that happen. So today we are not going with the normal session. We are talking about random things when people are in vacation, missing or irregular medication. You have traveled and you forgot you are taking drugs. The excitement makes you to forget the drugs, like antihypertensive, anticoagulants, and antihypoglycemic agents that are used in diabetes. Missing or irregular medication. You forget. No, you are in vacation at home. You have gone out with friends because you travel and your bag is at home. It comes to the time that you take your medication, like 9, you don't have it. Now it starts to be irregular. It worsens hypertensive crisis, stroke, or sometimes you may get high sugar levels. Hmm? High sugar levels. Physical and emotional stress. You know, when you are traveling a long distance with bus or car, you have what? Emotional stress. And you give your body stress, delays, yeah, planning pressure. You know, activate sympathetic system. And you know, when we talked about the sympathetic system and parasympathetic system, heart rate goes up and BP goes up, and it can trigger cardiac arrest and myocardial infarction. You have noticed some people when they travel for so long, their feet swell because of water retention. It is because when you travel for so long, the excitement and the traveling itself, it excites sympathetic nervous system. Exciting sympathetic nervous system leads to high rate of the heart beating. You get it? Prolonged immobility, long flights and buses, blood stasis, it stops. Hmm? Your blood does not circulate well. I usually say exercise helps when you are walking, you are doing things. The calf muscles of your leg helps to push blood. So please, everyone who is, if you have forgot to give me a like, my friend, likes bring people. Facebook, no, YouTube and Facebook also. When you want to bring people together, what do? You always do what? Let me see. You always do what? Like, so that people can come and come and come and always come. So my people and everyone who is watching, my people and everyone who is watching, long flights and buses, if you are going for long rides and on a bus, stop somewhere and walk. You get it? Stop somewhere and walk. Hmm? Risk of dehydration. Risk of dehydration is high. You get it? So if you are watching, my friends, please have your like, and let's continue. Let's continue with this chat. Uh, High altitude exposure. When you go to a place that is high altitude, what happens? You get low oxygen levels. And when you get low oxygen levels, you may tend to get heart failure. High altitude. If you are visiting places with high altitude, please, you should, at least, those people, if you have ever traveled to areas of Himalayas, around Himalayas, when you go there, some people go with oxygen tank because it is high altitude and oxygen is deprived. You see? Hmm? So when you are traveling at high altitude and you have an impending problem, mostly when you have uh, cardiac issues, please walk with your oxygen. Dehydration, common in hot climates or travel. You are going to places that are semi-arid. Here in Kenya, we have a place called Turkana. The desert itself causes electrolyte imbalance. Your kidney suffers, and then you get heart problems of arrhythmias. You get sleep disturbances, poor sleep, stress hormone. You get it. When you have sleep disturbances, you always have release stress hormones in your brain. You always release stress hormone in your brain. So um, there are some people that never learn. I'm sorry to say that. And some people that never learn. You have chest problems, you are diabetic. Doctor, yes, smile in the city. Thank you so much. Welcome to the. It's a good evening here. It's already 5:30. It's a good evening here. So we are talking about some emergencies that can happen when you are in vacations and what can excite. And then we tackle there how the emergencies can give a first aid. So smoking more than usual and you are diabetic, smoking more than usual and you are hypertensive. I've met some people like this. Hmm? You give doctors hard time. You give doctors hard time to work on you, and then you go to vacations and you go to a home. Skip exercises or suddenly overloading it. Sometimes when you are now, because we are saying exercise it's 10:30 a.m. here. Oh, okay. We are telling you that exercise is good, so when you feel bad, you are still struggling the attack. Now you go to the gym and you tell the person who is the instructor, now I want to work out so well. Instead of starting gradually, you start it and you go continuously working very hard. That is not the way. Yeah, that is not the way. And you know what escalates these things? You have already got the attack. You have delayed hospital visit. There is no place around. There are some places when you go to vacations, you can only see hotels with no medical facility around. So you delay, and then it becomes fatal, or you start ignoring symptoms. You are drinking with your friends, you are partying, you are taking everything because you don't want to leave the vicinity. You start ignoring the signs. You start ignoring the signs. Yeah? You start trying even new substance because someone told you if you take this heart when you have heart diseases, you will feel better. You will make your heart die off, my friend. You will make your heart die off. We have sometimes skipping exercise or overdoing it. It's not good. Don't overdo exercise. If you feel you are strained, stop it. Go and rest. You see, it is very important. You are going to a place that is you are unfamiliar with the environments. Please be familiar with the environments before you go there. So we have talked about how many points are those. We have talked about points like myocardial infarction, cardiac arrest, ventricular tachycardia, atrial fibrillations. Or I know these terms right now, you are used to them. If you are not getting what I'm saying, you just say, I will explain, because every day is a new day and every day we get new terms, even if we said them yesterday. Hypertensive emergencies, 180 over 120. My friend, because you are in vacation. Pulmonary embolism, unstable angina. That one I've said here in the background busy. It's okay, Sha travels, I understand. Unstable angina. Chest pain, I've said unstable angina is chest pain at rest. But when you are working or walking, you are okay. My friend, if chest pain is at rest, just know you are having an impending myocardial infarction, which means your heart is losing what? Your heart is losing oxygen. Aortic dissection, sudden tearing chest, back pain. This is an emergency. Aortic dissection, it's an emergency. And I've said things that can escalate this. Diet change, alcohol consumption. There, imagine every time we talk about problems, what brings problems? You notice there is two things that never miss. If you do heavy exercise, what should be your beat? Heartbeat, your blood pressure or your heartbeat. Smile in the city. That is a beat. Heart BP or heartbeat. There is a difference between heartbeat and I've seen you've written BPM. Please confirm, but I'll explain. I'm saying since we started talking, when you talk about things that are bringing problems, there are two things that always come out. If you have noticed, two things always come out that brings problems. Even other things are there, there is two things: alcohol and smoking. Two things. I've never seen where we don't have alcohol and smoking in medical issues. And you will notice missing irregular medication. Big Banana, today you are here, Big Banana TV. Where are you taking Easter from? Eh? Where are you taking Easter vacations from? Beat per minute. Oh, beat per minute. That is heartbeat. Yeah, smile in the city. That is heartbeat. You see, heartbeat when you are doing exercise, running, it can go up to 100 to 150. But when you rest, it goes down up to 60. So it is reversible, eh? Just in the house from Karen, bro. Oh, nice, nice, nice. Now, one day when I'm passing that road of the hub, I will call you. Around the hub, Big Banana, or Kabwagi. When I'm at Kabwagi, leaving home, I will call you, right? Or when I'm in those areas, we will meet the one day with you if you are around Karen. Now, you see, what I'm saying is, I was explaining first to Smile in the City. When you are working hard, running, it can go up to 150. It has no problem. That one has no problem. But when you rest, is there a danger point? No, it's not. There is no danger point, but it cannot go above 300. It can't. It can't. If it goes above 200, that is a problem, and it cannot. So heartbeat is reversible. The only problem we have is pulse rate. That is pulse rate, and what you are saying is pulse rate. If your BP goes high, so when you are waking up and your heartbeat is high, like 150, don't worry, it is compensating. So that is a physiological function. If you are coming right now, please like the video, and if you have an experience, let's share it. So we have said alcohol and smoking is questionable. Me, I will tell you, smoking is always questionable. If you are smoking, please stop smoking. If you are smoking, my fellow friends, if you are smoking, it is smoking, it is smoke. And we talked about free radicals. Smoke brings free radicals, and you saw how cancers can bring high cholesterol levels, MI, heart attack, smoking. I even say at least alcohol, when you take it low, it's okay. But me, I don't like alcohol. When you take at least small quantities of alcohol, it's okay. But I don't love alcohol. You see what I'm insisting? But smoking for me is a no, a big no. So we continue physical exercise re, over reduction is another thing. Sudden intense activities, and especially risky for unfit individuals. You are so thin, you have never gone to the gym and you want to do it. Prolonged mobility, dehydration, we have talked it. High altitude, go to places that are high altitude. For travelers, if you are a YouTuber and you are a traveler, please, before you visit a place, there are some people who take contents of travels, contents of travels. My friends who are here who are YouTubers and you want to start content of travel, before you visit a place, get to the required government state offices. Ask, If I go there, what are the requirements? Because I'm coming from this region. You're coming from maybe a low altitude. You have never traveled to that place. Yeah? Ask so that when you go, if they tell you, do you have an oxygen tank? Go and buy. We don't want to lose lives because of, of ignorance. You see, sleep disturbance, life extremes. So these are the things that we have looked at, and there are some things that we need first aid because they can happen. Hmm? If there is no hospital around, hmm, what are the first aids that we can? Smile in the city is saying, Smile in the city is saying, you said smoking is a no-no. What about the herbs, Ganga? Smoking is a no-no, but the herbs were used as medicinal. They were not used every time. Smile in the city. You could not just wake up one day and then you start taking herbs. No. Oh, or you mean ganja. You mean ganja. Now, I understand. Let me now give you this. That marijuana cannot kill you. It has 100% therapeutic index. Therapeutic index meaning it cannot kill you, but it can make you be psychotic. You see, it can make you be psychotic. We talked about ganja some times ago, the cannabis indica and sativa. Go to our playlist, you will see it. One of my playlists, mostly on mental health. Go and check it out. And there is a playlist of herbs which is named on complementary medicine. Go and read about ganja. 100% greetings, Benjamin, and everyone here. Having headaches, so I'm trying to let the lives to run for supporting. Oh, thanks, Marcia. Sorry for that. Sorry for that. It will be okay. So, smile in the city. Would you rather be psychotic, or will you rather get something like when you take alcohol? What do you get? You get liver cirrhosis. So marijuana can make you psychotic. If you are here and you have not liked, please like at least I get some impressions. Like at least I get some impressions. Let me tell you one thing. Ganja can make you be nuts. It can't kill you. It has 100%, 100% what? It has 100% therapeutic index. It has 100% therapeutic index. But the alcohol can give you liver cirrhosis. So, where do you want to be? Do you want to get liver cirrhosis or do you want to be nuts? Do you want to be psychotic? Check on people who take a bang every time and check how they behave. You will see. Ridley in the house, 1963. Ridley, that's never seen. Ridley is a good content creator. He goes where he's never seen. That's why he's called Ridley Never Seen. Yeah? Big up Ridley, Jamaican uncle in the house. Big people, two big people in the house, good friends of mine. Cute Jessie is here. Today you are not asking any question. Ask a question. You know, Cute Jessie is still my younger sister. When she asked a question, she asked any question, it amuses me and I answer it politely. Cute Jessie, bring it on today so that we can know. Now, we have talked about those accidents that we can, none of them for me. Smile in the city, yes. You don't want to be psychotic and you don't want to have liver cirrhosis. So let's avoid these things. Let's avoid these things. Okay. Now, yes, listen, just drink music like me. Drink music. When you feel you are down, drink music. When you feel you are down, smoke music. Yes? When you feel you are not getting where you want, drink music. Yeah. And your mental health will be stable. Drink laughing. You see, is it true people who smoke, it's hard to stop? No, it's not hard to stop. Positive music, of course, really. Positive music like reggae music that is roots and culture. Like roots and culture. When they say, one day it's gonna be a payday. You see, payday got to be one day. You get it? Get through good music. Listen, let it flow through your skin, let it flow through your brain. Sometimes music is a good thing. It makes you feel better. It makes you see when a person like me, when someone does something to me, what about second hand smoke? Second hand smoke. What do you mean by that really? If you are coming in, please don't leave without giving a like, my friends. Give a like. What do you mean by second hand smoking? Smile in the city is laughing at me. If not everyone, people, are you with me? Are you against me? Will you stand before Kokoti, the real messenger himself? It is not everyone who can handle the saying Senkamin, but I know some people who can handle it. Benjamin, and to me, they are wise, just like Benjamin, the wise guy. Come on, uncle, always on top and positive. Yes, yes, I can see some people ain't giving me some likes, man. Give some likes. We want to get some more impression. Second, smoking someone smoking around you. Oh, second, I see. We call it passive smoking. I've got it. I'm see. We call it passive smoking. When you are seeing someone is smoking around you, chase that person around you. Chase that person, go. And that's why in some countries, there there are some places for smoking. Even in Nairobi town here, you'll see some places of smoking for those people who cannot stay without smoking. Passive smoking is bad. It is also bad, just like the smoking itself. So don't be around people who are smoking. We call it passive smoking. Hmm? Even Morgan Heritage said, legalize it, but don't misuse it. I will not sing that song. I don't want to sing it right here. You see, so smoking is smoking, and there is no good smoking or passive smoking. Second-hand smoking is bad. What is it everywhere? We have it. Yes, you see, you have it everywhere in the US. You have it everywhere in the US. Smoking brings cancer because when you smoke, you release tar. And when you release tar, it destroys the cells and it gives some things called free radicals. When you have free radicals, tell me say when you have free radicals, high cholesterol level. While I was visiting Kenya, I didn't really see many people smoking, not like in the US. Yes, because if you smoke and you in town nowadays, there are so some people that are called county officers. We call them kanjos. County officers may arrest you. And coming out from county officers, you need something, yeah. So I've told you it's good to have something to do. Like when you are sad, when you want to excite yourself, do something positive. Do something positive for yourself. You get it? Do something positive for yourself, and make we do it. We make we do it. Yeah? And make we do it for Jah. Go make we do it, come make we do it. Make we do it, come make we do it. So you are doing for, let me do it for Jah. So say, Jah Rastafari, through the music and culture. Yes, we do it because these bodies are the temple of God. They are the temple of Jah. Let's make them a good place. See, when you destroy your body, you are destroying the body that God gave you. Burning spear, yes. Burning spear himself, really. Yes, yes. Somebody told me I think my bloodline should be from the Jamaica. Eh? I'm still loading it. I'm still loading it. I'm still logging it. Someone is saying here, You will be arrested by Kanjo here in Nairobi. So really, if you smoke in town, you'll be arrested. In Nairobi town, if you smoke, walking around smoking, you'll be arrested, even a cigarette. There are those county officers that walk around there. You're looking those people who are notifying the environment. And you know, smoking and smoking around, that is polluting the environment. You know, the artists with the culture music. Yes, the artist of banning of culture is called Joseph Hill, Joseph Rodney Hill, but he passed on. May his soul rest in peace. So those are the things we are talking about. Now we get to to see. Let's get to see the first aid for cardiac emergencies. Eh? And there is no hospital around, no hospital around, and we want to save a life. So myocardial infarction, if you notice the signs that we have said, myocardial infarction, you stop all activities, sit or lie in a comfortable position, loosen and tighten your clothes. Myocardial infarction, I've said, is maybe when one of the heart muscles, when one of the heart muscles is losing what? When one of these heart muscles is losing, yes, in the house, Dr. Hello, Rich Sue, nice, thank you. Don't forget to like Rich Sue. Today I'm happy you're here. Today I'm happy you are here. Sometimes you get me when I'm not here. So, Rich Sue, please ask me a question. You don't go without asking me a question. Yes, please, please, those people who have not given me a like, I like being liked. I like being liked. Give me a like, please. And share this, share this, share this. So when you have my Banangi, Banangi, I miss Barbara. Hey, Barbara. Barbara, when you are live, please, you have my number. Be calling me so that I can sing for you in our language. Yes, my sweet sister from UK. I don't lose me, Bwana. Don't lose me. Don't lose me. Don't lose me. I miss you when you are not. I like visiting your chats. We talk. You understand? Yes, Barbara, and everyone also. Now, stop all activities when you are having you feel the signs of myocardial infarction. Big up to Smile in the City. If Smile in the City, you have a channel. Everyone who is watching, go to the channel of Smile in the City. He promotes everyone regardless. As long as you are a positive there, he promotes you. He doesn't. He's a good guy. Uh, Now, let's go. Give aspirin 300 milligrams and chew if not allergic to aspirin or clopidogrel. Those are thinners, blood thinners. Clopidogrel is a blood thinner and aspirin is a blood thinner. So when you have signs of myocardial infarction, you give 300 milligrams. Those ones you can get over the counter everywhere. Monitor breathing and pulse. Monitor your breathing and pulse. Please breathe slowly out. Slowly out. Go to somewhere, if it is very hot, go somewhere in a shade, lie at a position that you are comfortable. When you are feeling this, avoid giving food or forcing movement. Some people give milk. Please don't give milk. Please don't give milk. Don't force a person who is having myocardial infarction. It will worsen the situation. It will worsen the situation. Please don't give milk. And I've said what I'm saying is myocardial infarction. Signs of myocardial infarction, please, if you are getting in right now, go through, you will see them. You check this picture of a heart. Myocardial infarction is when a part of this is dying off and is not getting oxygen. We have already talked about it. I can see some people are coming in. If you are new here and you are just watching, please don't forget to thumb up and share. If you like it, and if you're saying Doc likes to talk a lot, what about trying to cough at that time? No. Maje, that one is a no. Coughing excites blood pressure to go up. So if you try to force, you are forcing the heart to have more problems. So no. Can they drink water if they are thirsty? Yes, but not a lot of water. If they are thirsty, yes, yes, yes. Good, good one. I've said that is about myocardial infarction. If you are coming in late, please go through the video. Check on signs of myocardial infarction. Check on signs of myocardial infarction. Let's go on to cardiac arrest. Cardiac arrest. Check responsiveness. Someone can just collapse and you already know this person has a heart condition. If no breathing, if no breathing, this is where now you need to take notes, or you revisit and listen carefully. This is a life-saving moment. Listen to this, a life-saving moment. If this person has lied down and is not breathing, eh, push hard to the chest. Don't push. Don't feel that you are killing the person. No, push hard. You know CPRs. Take this hand, push it here, put it above, push hard and fast. 100 to 120 minutes. That's like a minute. Like this. You are like this. You see? You see? Look at me. I'm like this, and I want you to watch my hands at the table. My hands are like this, and you are pushing, pushing, pushing. Now, what you are pushing is the chest cavity here. That is how you have pump the chest. Yes, for a minute continuous, very faster. Cardiac arrest, very faster. Now, there is no hospital. You are you and you plus the person who is going. And this person has collapsed. 100 to 120 minutes per minute, very fast. About 5 to 6 centimeters of depth. As you are pushed, don't push. You check the depth, but you can be pushing like this as you check. 30 compressions. You see, if you do 30 compression, that can go around 110, 120. 30 compression, like let's try, my guys. It is very important to learn these CPRs, like this. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, up to 30. Then you give 2 breaths. 2 breaths. Don't say that this person may be give 2 breaths through the mouth. 2 breaths, then you continue. Use AED. If you have the AED, the pump, please use it. But sometimes at home, where you get the pumps? So try this for more than 12 times until this person wakes up. This is cardiac arrest, and now you are trying to pump the heart. It will wake up. Try at least until 12 times. Don't be scared now. We are saving a person. Yeah? So we have said chest compressions, push hard for around 1 to 120. The chest compression should be at least 30. Then 2 breaths, then 30, then 2 breaths. This is a life-saving moment. 1, 2, 3, 4, 5, 6, up to 30, 2 breaths. Again, 1, 2, 3, 4, 5, 6, 7, 8. What can cause cardiac arrest? Oh, Ridley has come in late. Ridley, I will explain. Let me just continue. I had explained earlier when we started, and let me see. There are some things when you come late. You see, when you come late, you can't be conversant. But when you revise the you revise the video and watch it so slowly, you start learning that some things. So let me continue so that we can finish and then answer that. We can finish and then answer that. So do not stop until help arrives or persons respond. Don't stop, because you are keeping the blood continue to flow to the body, and maybe the excitement will awaken the heart. So as you are doing that, someone else is shouting for help or an ambulance. You get it? So you continue until help comes or until that person wakes up and blood continues to flow. Okay. Yeah. So that is about cardiac arrest. There is something called arrhythmias. Have you ever had, if you are coming in and you've not liked, please let's continue to like. I can see Barbara today. Barbara, talk to me. Hmm? Talk to me today. I see. I feel you are around. There's something called arrhythmias. Arrhythmias are very bad. Arrhythmias, you can even feel, sometimes you can feel your chest pounding and vibrating. Pounding and vibrating. Who is that who has not given a like? Who is that? Let's give likes and continue. Pounding and vibrating. So when a person tells you, I can feel my heart is beating so hard, let that person rest. Let that person rest. Encourage slow, deep breathing. Yes, if conscious, try vagal maneuver. You remember vagus nerve? Vagal maneuver is cranial nerve. Vagus is cranial nerve number 10, the one that causes the parasympathetic nervous system. So when you excite it, it removes, you remember, acetylcholine, and then acetylcholine goes to the heart and it does what? Reduces the breathing. E.g., bearing down like passing stool. That is, you squat like you are passing stool. It excites when you are squatting like you want to pass stool, it excites parasympathetic nervous system. You get it? Give fluids if dehydrated. If faint occurs, treat as an emergency. Please find a hospital. So when you are with palpitations and your heart is beating so fast, you lie down as if you are going to pass stool. You squat as if you are in the toilet. It excites the vagus nerve, and the vagus nerve, when it's excited, it releases something called, it releases acetylcholine, which relaxes the heart muscles, and the heart starts to beat slow. You see, these are some of the technical things that you should learn when you are at home. At least that you don't have the problem of, you don't know what to do. You can do something and it saves life. So this is a person whose BP has gone high and is getting palpitation. And then we have something called acute heart failure. Acute heart failure. What to do is this: sit the patient upright, not lying down, loosen the clothes, provide fresh air, reassure and keep calm. Reassure and keep calm. Eh? Watch for worsening breathlessness and start to find how you can go to hospital. But now, this person maybe is under hypertensive crisis. The pressures are gone so high. Keep the patient calm and resting. You keep the patient calm and resting. Reduce noise or stress. If prescribed any medication, look around where the patient is or the house. If there is tech, use the dose. Even if this person had taken, because most of the people in their houses nowadays, they have the BP machines, the one that you use at home. Take it. Make sure you've seen it. The BP is high, above 140 of 120, or above 140 of 100. You see? Hmm? So that, and today no one is posting any links. What is happening? Or moderators have gone sleeping, or they are listening carefully. Moderators are listening carefully. Hmm? Okay. What you can do is, at this juncture, as you are taking care of this person, and this person is having the hypertensive crisis, try and find the drug that this person uses at home. As you seek for a car, or you're trying to find help. Pulmonary embolism. Pulmonary embolism is when your lungs, or this pipes here have accumulated so much fluids. This is called the pulmonary artery that comes out from this side and goes to the lungs. So it may accumulate fluid much so that even breathing is a problem. Keep the person in a still position. Don't move. Avoid movements if it is accumulation of water in your chest and your heart. Sit or lie in a comfortable position. Give oxygen if available. It is an emergency. Start crying for help. Start crying for help. Aortic dissection, the aorta, as a problem, and you have a history that this person had an aortic dissection. Always keep BP low, calm, and no movement. Absolute rest, bed rest, and it is urgent evacuation to the hospital. So as this person is taking rest, bed rest, you are trying to find a way he or she can get to hospital. Unstable angina, chest pain when you are at rest. Same as heart attack, first aid. Rest and give aspirin. When you are resting and you are okay. When you are resting and you feel pain, you get it. That is how severe mucus is to the heart. Mucus. Uh, Mucus. Let me talk about this about mucus in the heart. Mucus come from the nose, or I've not really understood it, but maybe I feel Ridley is asking how severe can it be, fluids getting into the heart. Ridley, there are two types of fluids that can get into your heart, and this one, let me see. Let me see. Let me show you this. Let me show you this. You see this part of the heart, these layers, there are three layers. If it is filled and there is some water that is around these areas, what will happen? This muscle will not pump blood because it will be filled with water. That is one. It is called pericardial effusion. And two, there is the second one is this one. You see this one, this pipe is called pulmonary artery. When it goes to the heart, to the lungs, and sometimes maybe you are sick, and you start piling mucus and some fluids, you will feel chest pain because you will not breathe well, because that artery is going to the lungs, and in the lungs is where you exchange oxygen. So the chest pain will come because blood is not flowing as needed, it is stopping, so it is severe. How severe can it be? It is an emergency. Really, that one I'm telling you, it is an emergency. You need to go to the hospital so that you can be treated. People that have TB, they undergo this issue so much because of the bacteria producing more secretions. So if you have that in your plate, it just know it's an emergency. You need a hospital. Okay, we have unstable angina when you are resting and you are having chest pain. That one we have said you do what? You rest and have some aspirins and monitor closely. Unaona? You see that? And monitor closely. So it is important to note these things. It is important to note these things, and it is very important to know the first aid you can do. Please, this is a video that you should watch 3 times or 4 times, because when watching, you can save a life one day. Doc, did you know human body functions similar to a car engine? Hey, 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 Ridley. Now Ridley is making me. Christine Long, welcome to the chat. Welcome to the chat. Welcome to the chat. Ridley is telling me human body is functioning like a car. Hey, you know Ridley can dismantle your car's engine and bring it back to life. So Ridley thinks like a real machine. Until now, Ridley is looking at a human being and seeing that heart seems to be like water pump. You see, when you look at the fuel pump, that fuel pump seems to be like let's say a stomach, because the stomach is the one which gives the body energy, and a car, the fuel is the energy producing center. Now, Ridley, let's go. Let's continue. Ridley, my friend, you make me excited at some time. Eh? Now, we say pericardial tamponade is lungs is a carburetor. Continue, Ridley. The lungs now. Let's get to listen to Ridley. Ridley has told us a human body is like a car and the lungs is like a carburetor. Hmm? Hmm? Is like a carburetor. You see that? Hmm? You see that? The lungs is like a carburetor. Now let's continue. Let's continue to pericardial tamponade. That one you have talked about. You sit the person upright. After sitting the person upright, keep calm. Urgent transfer needed. Urgent transfer needed, and syncope, cardiac cause, syncope, lay flat. So with that being said, people have to take very good care of their body. Yes, people have to take good care of their bodies, and that's why we always have these talks. Yeah, we go to school to learn medicine to take care of our bodies. You get it? We go to school to learn medicine to take care of our body. So pericardial tamponade, you sit the person upright, keep calm, urgent transfer to hospital is needed, and and syncope syncope, we have you lay the person flat and elevate the legs, ensure airway is open, check pulse and breathing. You check pulse and breathing. Now, those are some things you can do when you are under attack. Now, anyone with a question as I'm finishing, they said your body operates from temperature. Yes. Yes, Ridley. Anyone with any question while I'm finishing, stay calm and call for help. So, listen to this. Listen to what I'm going to tell you. These are very important. Stay calm and call for help, even in remote places. You check that person's airway, breathing, and circulation. Very important. Position correct, chest pain while sitting. Unconscious, put in recovery position, sleeping on the left arm and the right leg over the left leg. That is called recovery position. You get it? Give aspirin if chest pain unless contraindicated. Always, if you have no contraindication of aspirin, give aspirin. If there is no breathing, start CPR. If there is no pulse, the CPR is the chest compression as you are calling for help until an ambulance or help comes. What to carry during vacations. As I finish, if you have a question, please put it up. As if you have a question, put it up. And please revisit this video all times. Revisit this video. It is very important. When you're going for vacations, always carry aspirins, personal medications, water, emergency contacts, basic first aid kits. You get it? Always carry those. I repeat, aspirin, very important, or clopidogrel, 75 milli, clopidogrel. It is called, it's like aspirin, it's called clopidogrel, 75 milligrams. Personal medications, water, emergency contacts, and basic first aid kit when you are going for vacation. Red flags, things that you can see and then you see this is a red flag: loss of consciousness, severe chest pain that goes up more than 10 minutes, difficulty breathing with no pulse. Very important. It is very important. Now, uh, anyone with a question, I think I've done good to bring this up, and now you know what to do when there is an emergency. Anyone with a question before I log out? Let me give a minute. Let me give a minute before I log out. Anyone with a question? Please, if you have come in late, go through this video. It can save a life. It can save a life big time. Hmm? Anyone who has any question before I log out? Okay, there is no question. Enjoy your vacations. It's Easter holiday for Christians. Continue praying that we have a good world with no hatred, peace, love, and unity. Bye. See you tomorrow. It's a Sunday. I don't know if I'll get time, but if I get time, I'll come live again. Good times. Enjoy your holiday. Happy Easter. Bye. Bye bye.